Well, good evening and welcome everyone. Thank you so much for joining us for another wellness webinar series event with Jefferson Health. My name is Sarah Breckbill and I will be serving as your program moderator. Well, Jefferson Comprehensive Weight Management offers a full range of surgical options for weight management. We understand that being overweight is a chronic condition that requires long-term care and committed treatment, as well as respect and vigilance. Well, thank you for submitting your questions in advance of tonight. And the questions that you'll hear me asking our panelists are all submitted right from when you registered for this webinar. And if you have any questions throughout our discussion tonight, for those joining us on your computer or tablet, at the bottom of your screen, you should see an icon that says Q&A. We'll do our very best to get to as many questions as possible, but may not be able to answer all of them during tonight's virtual event. And due to hospital, university guidelines and privacy, we are unable to comment on specific cases. Likewise, if you are experiencing any symptoms that may require immediate medical attention, please consult a medical professional. Well, without further ado, I want to go ahead and introduce our experts for the evening. And I'll have you both go ahead and just give a little background information about yourself for the audience. So first and foremost, Dr. Ramsey Dalala, welcome, bariatric surgeon. How are you doing this evening?
Wonderful. And thank you for putting this on and having us and giving us an opportunity to reach out with, our community.
Absolutely. All right. Well, thank you so much for joining us. And now I will turn to Dr. Adeshola Fakaluja, also bariatric surgeon. How are you doing this evening?
I'm good. Thank you very much. It's a pleasure to be here speaking on this forum. Appreciate that.
Absolutely. And I know we have a lot of questions to get to. We've received already so many great questions from the audience. So I know that we will have a great discussion tonight. So let's go ahead and dive into it. So for question number one, if you're ready, Dr. Dalala, who qualifies for weight loss surgery?
Well, the qualifications really depend on your weight and on your medical conditions. And the exact numbers may be hard to calculate because often we go with a number called body mass index. And if you don't know your body mass index, that's okay, but there's lots of calculators online and we have some on our website. And anybody who's about 100 pounds over their ideal body weight is generally a candidate for surgery, but there's some wiggle room depending on what medical conditions you may have, especially ones like diabetes, or high blood pressure, or sleep apnea.
Okay. Well, thank you so much for breaking that down for us. And Dr. Fakaluja, is bariatric surgery covered by insurance? Do you mind kind of diving into that a little bit?
Thank you, Ms. Sarah. So yes, bariatric surgery is actually covered on most insurances, though they do have different criteria for coverage. But you do have to find out from your insurance if you have bariatric benefits. So even though, for example, Horizon might cover, but the Horizon that is by your employer may exclude bariatric benefits. So you have to find out. But generally, insurances do cover bariatric surgery. They have different criteria before you can qualify for bariatric surgery. Dr. Dalal already mentioned the BMI, but also you have to go through nutrition and see a number of physicians. And the different insurances have different nutritional requirements. Like Blue Cross Blue Shield, you have to do nutrition for about 6 months and you can't miss a month. Aetna, I think, is about 3 or 4 months. And then Horizon, you need 10 visits or 5 visits within 90 days. So they all have different requirements that once you satisfy the requirements, then they would approve the surgery. So far, you met the BMI criteria and the comorbid factors. Also, I think it's Horizon. On that insurance, you actually cannot gain weight. If you gain 1 pound, then they don't approve it. You either stay at the same weight or you lose weight.
Okay. Well, thanks for going through that. And I guess as a follow-up, talking about the actual procedures, how would you determine which surgical procedure is best for you?
Thank you. Good question. So we do different types of bariatric surgery, and usually when you see one of us, we'll just go into detail. We do the sleeve gastrectomy, gastric bypass, the one-nose switch, or something called the SADI. We don't do the gastric band anymore per se, but we do revisions also. That means we're changing one form of bariatric surgery to another to augment further weight management. Now, the most common one we do, I think all over, is the sleeve gastrectomy, in which we take out a portion of the stomach that controls the appetite more or less, but we don't touch the intestines. Now, the surgery we do will depend on the patient, what the patient wants, and then the comorbid factors of the patient. And I'll just give an example. I know we don't have a lot of times on this forum, but for example, a patient with a BMI of 40 comes to me for bariatric surgery. A young patient, no other comorbid factors, no high blood pressure, diabetes, sleep apnea, no reflux disease. And, that patient will do well with the sleeve gastrectomy. With the sleeve gastrectomy, you can lose about 50 or 60% of your excess weight. Your excess weight is how much you're overweight by. But another patient comes to me with severe acid reflux, like heartburn, and they're on medications, and they want to get off medications, or they have long-term diabetes that has been difficult to control. For patients with reflux, then I'd go more or less towards the gastric bypass, because the bypass is more or less the best anti-reflux bariatric surgery you have, rather than the sleeve. In the sleeve, about 1 in 10 patients may develop acid reflux. Patients with very bad diabetes, then you want to go either towards the DS, the bypass, or the SADI, which is the single anastomosis duodenal ileostomy. So it really depends. When you come to the office, we look at your medical problems, we look at what, and then we ask you what you want, and then we go into the details, the risk benefits, and what you want to expect, and then we pick the procedure. Thank you.
Okay. A follow-up there, which I know is a popular question for many. What do the recovery times look like for these procedures?
Okay. So most of the surgeries, almost all of them, are done minimally invasive, either laparoscopic or robotically. So for the hospital stay, is either 1-2 days, almost always. Recovery time, going back to work, is going to vary. And I always tell the patients anything from a week to 4 weeks. In the real sense, I always say if you work for yourself and you get like a sleep, you can actually go back to work in a week. But most patients take an average of 4 weeks of work. And I always say, you can always go back to work early if you want. So far you're tolerating the liquids, there are no issues, and then you'll be the hero. But if you want to take the whole 4 weeks off to recover, then by all means. But usually the main restriction after surgery is we want to avoid heavy lifting, weights, just for about 1 or 2 weeks. Otherwise, you're able to walk around. In fact, we advise you to walk around the night of the surgery.
Okay, well, thank you. All right, well, we will move ahead now. Dr. Dalala, what exactly is the process like? I know that we're going to be talking about a program here. Are you allowed to dive into that a little bit more?
The process to get to surgery varies a little bit by individual. For instance, a healthy young individual may be able to get through the process quicker than somebody who has some severe medical problems or who may be much older. It also depends on insurance. One of the biggest hurdles to overcome with insurance and getting to surgery is the number of dietary visits that are required by the insurance company. And these, quite honestly, are designed to discourage people from having surgery. They're designed to slow the process down and create frustration. Because in fact, we could provide all the education necessary in a single sitting, but we're required to spread them out over multiple sessions, over multiple months, varying on the insurance company. The process also, because insurance rules, if we're going to get insurance approval, often would be getting a psychologic clearance. Personally, I take a little bit of offense to that. We don't get psychologic clearances for other elective surgeries. I mean, everybody may need a good therapist. Nothing wrong with therapists. But in order to say you have to have a psychologic clearance for this particular procedure versus not for another is a little odd. But we're at the whim of insurance rules. And unfortunately, we have to play those games. And so those are some of the big hurdles in the process to get to surgery. The education, which everybody needs, but insurance requires different rules. The psychologic clearance, which can be somewhat onerous to get or feel invasive to get and slows some people down in the process. The basic labs and testing anybody would get prior to any elective surgery. And then to go into further labs and testing really depends on the medical condition of the patient, the type of surgery we're undergoing, and the individual office's routine practices.
Okay. All right. Well, thank you for breaking that down for us. And, appreciate that nod to insurance. Definitely a process there. So thank you. All right. Turning back to Dr. Fakaluja, is there an age limit to surgical procedures for weight management? Do you mind diving into that?
Yeah. Well, we start at an age of 18. We don't do pediatric bariatric surgery. But as to the upper end of the spectrum, I don't think we do have an age limit for that. Because I've done a 77-year-old female before. So if you're functional and you have years ahead to live, then no, we won't refuse you surgery. So there's really no cap to it. I mean, I guess we'd be wary if you're doing a 90-year-old, but we probably won't do that. But we don't have an age cap to it in a real sense.
Okay. Well, that's good news to hear. Thank you. All right, Dr. Dahl, can you talk a little bit about the short and long-term weight loss looks like after surgery?
Great question. Everybody wants to know what their goal is. And, I often tell patients that depends on your perspective. For instance, I could tell you what the average weight loss would be expected by any particular operation. That may or may not reach your goal. Some people's goals are just to get rid of their diabetes and they're happy to lose a lower amount of weight. So is it a patient's goals to what weight they wish to be and how they want to feel? Is it my goal, what the average weight loss is? Or is it a goal based on medical conditions? So goal is complicated, but weight loss, the average weight loss depends, one, on how much weight you start out with. So somebody who's starting out at 600 pounds, they may lose 300 pounds. They've lost 300 pounds, which is a crazy amount of weight. But another person who may not have started off as high, say 220 pounds, they may lose 70 or 80 pounds with the exact same operation, which is fascinating, right? The exact same operation, they lose different amounts of weight. The one who started off at 220 gets closer to the ideal body weight. The one that started off at 600 lost a whole lot of weight, but still is kind of heavy in the end. So the most weight loss that we generally see occurs around 18 months after surgery. That's when people hit their lowest weight. There's some variation person to person, of course. There's some variation surgery to surgery by a little bit, but every one of our operations, people lose a fantastic amount of weight. The majority of that weight is actually even in the first 6 months. So it's not like every week you lose the exact same amount of weight. The first weeks are very steep weight loss, and then it slowly levels out. And the unfortunate truth is between 2 years and 10 years after surgery, people can regain, on average, about 15% of what they've lost. So if I lost 100 pounds, I'd gain, on average, 15 back from 2 to 10 years. But you have to understand what average means, right? Average means half the people regained more than that and half people regained less than that. And if I say that the average weight loss that you will see at your maximum for somebody may be 100 pounds, depending on where they start, but that's also an average. Some people may only lose 80 pounds and others would lose 120. So again, the amount of weight loss depends on the total, how heavy you are to begin with. The heavier you are, the more weight you'll lose. You lose weight to a maximum of 18 months or so, and there may be a slow weight regain over time.
Okay. Well, thank you. And appreciate you kind of breaking down that average. So thank you for talking us through that. All right. Dr. Fakaluja, can you talk about the risk? This person is wondering, should I worry about after bariatric surgery? So any big risks that you could kind of detail for us?
Thank you, Sarah. So I mean, the bariatric surgery has been proven to be safe as any other surgery, probably safer now that we do it minimally invasive. It's probably safe, but the chances of you having issues with bariatric surgery is less than you getting an accident when you drive a car. You know, the data has proven that. But the most common issues after surgery, I would say, nausea, vomiting, dehydration, trying to keep the fluids in, which makes sense after surgery because we do reduce the volume of the stomach with all types of bariatric surgery. But other complications are similar to what you have with other surgery. Each time you do any other surgery, there's always the chance of bleeding, infection, something called an abscess, where you have a collection of pus that can be drained. Again, these are very rare. And then depends on the procedure you do, there's always a chance of what's called a leak. We do either staples or sutures. You can have a small leak from the staple line, which nowadays is much easier to manage. And then there's a risk of blood clots, which can happen with or without surgery. I mean, obesity on its own is the risk for having blood clots, or even like a travel, being stationary for a long time. And, we try and mitigate these factors because before the surgery, we give you blood thinners, and some people go home with blood thinners, depends on your BMI and your comorbid factors. So those are the most common issues we have after bariatric surgery, if they even happen, but they rarely happen. Most of the time it goes well, people do well, very low complication rates.
If I could, may have a follow-up comment. While there are always risks to surgery, this particular operation brings on a lot of fear and anxiety. People have shame and embarrassment and anxieties, also hopes and excitement as well. It's a mixture of emotions. All the risks that Dr. Fakaluja mentioned are real, but there's also real risks of doing nothing that are generally much higher, much, much higher than actually undergoing surgery. So we're operating not just to make you feel good in your clothes, right? We're operating to decrease medical conditions and prevent a heart attack and stroke and preventing early death from other medical conditions and decreasing medications and improving quality of life. So risks should be also considered with the risks of doing surgery, but also the benefits of doing surgery and the risks of doing nothing, which are considerable.
Absolutely. Thank you for adding that. And as Dr. Fakaluja said, the benefits certainly sounds like oftentimes they outweigh the risks. So thank you for adding that in there. All right. Well, Dr. Dalala, another question for you. This person is wondering, what can I do if I'm not meeting my weight loss goals?
Well, luckily, we have a group of experts in all of our offices at Jefferson that include, dietitians, behavioral health specialists, and surgeons to always try to ensure, one, people are safe and there's no problems that require correction, but to counsel people on healthy eating, provide support groups, provide behavioral support. And even now, in some cases, we can augment weight loss with some very excellent medications. So it's not just a surgery like you may have a back surgery or a hernia operation and you see the surgeon once or twice and that's it. This is a procedure where you're going to develop and should develop a long-term relationship with the office, the surgeon, and all the practitioners to ensure that we have maximized what the operation can do. Now, as I said before, there can be disconnects. I've operated on somebody who's 300 pounds and they really wish to be 120 and they're so upset that they're 150. And to me, that's the goal. Like they did better than average, but to them, they didn't meet their goals. So it's also important to set the appropriate expectations as well. And that's only by an honest conversation with the surgeon and the patient to ensure that we're picking the right surgery for the patient and setting what what everybody, ensure everybody knows what the expected outcomes will be.
Okay, great. Thank you. And I think, as you said, it's important to also think about those relationships that you're building. So thank you for detailing that. Okay, Dr. Fakaluja, after having a R and Y gastric bypass, can the stomach stretch and cause weight gain? Are there other procedures available?
Thank you, Ms. Sarah. So yes, with most any kind of bariatric surgery, there's always a chance that the stomach might stretch. Again, might stretch. The sleeve can have a little bit of stretching, but it never gets back to the original size. When we do the row-wide gastric bypass, we make the size a certain, the pouch, sorry, a certain size, and the row-wide gastric bypass, the pouch itself, that's the stomach itself, is based on something called the lesser curvature of the stomach, a side of the stomach that really does not expand. We kind of isolate the bigger portion of the stomach, so it rarely stretches, but there's a chance that the opening between the stomach and the small intestine may stretch. And I don't think we fully know the mechanism of weight gain after the bypass. As Dr. Dalal said, there's always an average of 50%, regardless of what bariatric surgery you do. But yes, we have options to treat weight gain after gastric bypass. We do offer revisional surgery. And for the bypass, it could be, we try and find out what has gone wrong with the original surgery. So we get tests done, either an upper GI and upper endoscopy. We want to see that is the pouch bigger than usual? And usually if the pouch is, that means the gastric stomach. If the pouch is bigger, a lot of times it's bigger posteriorly at the back. So if the pouch is bigger, then we can trim it. We check for the opening between the stomach itself, the small stomach and the intestines, and see what size that is. And we can also make that smaller. Rarely, in patients that, for example, smoke, they tend to get wounds called ulcers, and they can have something called a fistula, which is a communication between the old stomach and the new stomach. So the food more or less goes through the same route. If that happens, we can divide that communication and take out the bigger stomach just to make sure we have more restriction. And then finally, you can also rarely lengthen the limbs. When we do the bypass, you can lengthen the limbs to achieve more weight loss. So there are a few things we can do with that, with the gastric bypass revisions. We just have to do some tests and make sure you're candidate for the revision and see if we can help you with that.
Okay, thank you. Definitely options available. So appreciate that. Okay, Dr. Dalal, going back to you, talking a little bit about excess skin. So excess skin removal, is that covered by health insurance after weight loss surgery?
Yeah, big question, right? Once you've grown the skin, there's no good mechanism to ungrow skin with the weight loss. There's some normal elasticity in your skin. So losing some weight, there's a reasonable bounce back. But after a substantial amount, there may not be. And some complain of rashes or excess skin. Now, most people would say that having the excess skin without the weight in it is much better than the same amount of skin with the weight in it. But no, people who've lost the weight, they just want to feel normal. And they want to look in the mirror and say, I'm finally in a normal weight on the scale, but I don't feel quite normal. And they may wish help. Now, the truth is, exercise doesn't help all that much for excess skin. It makes you strong, it makes you healthy, helps your heart, helps your blood pressure, does lots of good things, but doesn't really help the excess skin much. Surgery is not a small surgery. It can be covered, but only in certain circumstances, depending on your insurance, the degree of excess skin, and any complications you may have from that. I honestly tell people you have to assume insurance isn't going to cover it and be surprised if it does. And sometimes it does. But again, most people who have the surgery don't end up feeling they need or want removal of the excess skin. It's a personal decision. I've had people that have had tremendous amount of excess skin and they're fine. They don't care. They have other things in their life. And I've had people which I can't even tell they have excess skin and they're very upset about it and they want something done. So who am I to say what is the right or too much excess skin or not? It's really a personal decision. And we can certainly guide patients to experts, because you do need experts who experienced at removal of the excess skin in patients who've had weight loss surgery. We can guide people to those experts so they can have the best outcomes.
Absolutely. Yeah. And as you mentioned, certainly a personal choice. So thank you for reiterating that. Okay. Dr. Fakaluja, we'll turn back to you. Talking a little bit about medications here. So once someone has had the surgery, will they be required for any lifelong medications?
Thank you, Ms. Sarah. So when we talk about medications, I mean, the most common thing we would give patients after bariatric surgery would be vitamins in a real sense. And depending on what surgery you've had, for certain surgeries, yes, you have to be on lifetime multivitamins and supplements. For something like the sleeve, when we do the sleeve gastrectomy, it's mainly a restrictive, although there's a hormonal effect to it, but it's mainly, there's there's no delay, there's no absorption issues with the sleeve. So you don't have to be on those multivitamins for life. We do encourage you to be on them, but you can, because you still get your multivitamins from food. That being said, we do check the vitamin levels at regular intervals after bariatric surgery is done. For things like the gastric bypass, duodenal switch, or the SADI, then you will have to go on certain multivitamins. For example, in the bypass, we bypass a certain area that absorbs calcium, iron, and there's a factor that absorbs vitamin B12. So you do have to take those supplements more or less for life with those procedures.
Okay. Well, thank you. All right. And Dr. Dalal, turning back to you, talking a little bit here about something that's been in the news lately, weight loss medications. Can you talk about what they are, what they do, and the pros and cons?
Right. Well, fascinating. A lot of these medications have been pushed into development because our surgeries work in similar fashion. And we've learned that our surgeries don't work really because the pouch is so big or the hole is so big or it works mainly by changing the hormones and the nerves that communicate with the brain to help you with the behavior of eating and the feeling of fullness and the pleasure you receive from food. And those hormonal and neural controls that are disrupted with surgery is why these operations work. The medications are trying to mimic those effects. And these medications that we have now, like Wegovy, Mounjaro, Zepbound, these are fantastic medications, and we are very thankful we now have them on the market. They work very good. They have about half the weight loss of weight loss surgery. That's far, far better than any phentermine or any old drugs that had been given before. They have been proven already to improve heart disease risk. And so we are big proponents of the use of medications, sometimes in lieu of surgery, sometimes augmenting surgery, sometimes as a way to prepare people for surgery. But the problems with medications are, one, there's a shortage currently, and they're very difficult to obtain. Two, they're very expensive and currently cost about $1,000 to $1,500 a month, which is just out of this world for most people. Insurance sometimes can cover it, but sometimes, many times, it doesn't. And there are side effects to medications. Again, there's side effects to surgery. With surgery, in the first few weeks and month, you may feel nausea, you may feel pressure, you may feel constipation, you may feel many of the same side effects that we see with medications. So there's side effects with both, don't get me wrong. But it's also, when you stop the medication, you regain all that weight very, very quickly. So I think we want all the tools in the toolbox possible to treat obesity as a disease. This is a great tool that's now been added, and in conjunction in a comprehensive program that can offer all types of treatments for the disease of obesity, this has been great.
Absolutely. And interesting to hear you say, this is just another tool in the toolbox. Definitely good way to think about it. So thank you. Okay, well, with that, I want to go ahead and jump to our live questions from the audience. I know that we've been receiving a lot of questions, so thank you all so much for submitting, and feel free to keep them coming throughout this discussion. But with that, I'll go ahead and just kick us off with the first question, and whoever wants to answer, feel free to chime in. But the first question here that we received, what important characteristics should someone look for in a surgeon? So whoever wants to take that, feel free.
Well, one, a person that you connect with and that you feel you can communicate with and that you feel will treat you like a person with care and respect in an office that's responsive and on top of it all, who has experience. So those are the qualities of any human that you would want to be friends with. But there are also good qualities of a physician because this is a long-term relationship and you should be able to connect with that office in case you're having problems, be comforted knowing that when you call, you'll get a responsive, thoughtful, caring answer. And again, we're not just surgeons doing this. We are helping manage return of your long-term health over years. And you want to find a place where you can develop that home and that relationship.
Thank you. I think that's a great answer, so appreciate you diving into that. Okay, our next question here that we received from the audience, how long after birth with no complications can you have surgery?
Yeah, I mean, I can take that. So I always say at least 6 weeks to 3 months. I don't think there's a set time, but usually the effect of the pregnancy wanes after the uterus usually involutes after 6 weeks. So 6 weeks to 3 months after birth, I think you can start looking into the process. So far, you meet the BMI and other criteria put forth by the insurance companies.
Okay. All right. Well, thank you. Okay. So next question here, and I know that we talked about this a little bit, but if you want to dive into this a little bit more, I think it might be helpful for the audience. Why choose surgery over weight loss drugs?
Well, surgery is by far more effective, not just in the short term, but in the long term. Surgery is much cheaper in both the short and the long term. Surgery should, again, it's not just surgery, but should offer you a home for all your care for weight loss, whether it is counseling with dietitians and behavioral therapy or what may be. However, it's not just a binary choice. There's options for both. And how do you decide which and when is the right ones for you? Should you try medication first, then surgery? Well, I mean, I've had patients that are so sick that they need the weight loss fast, or they may not survive so long. I don't have time to waste for a medication that may or may not work or achieve those goals. Should medication be used concurrently or in series with surgery? And so these decisions, I think, should be made in consultation with a team of individuals who has expertise in weight loss.
Absolutely. Okay, well, thank you. All right. Well, Dr. Fekalusha, someone actually in the chat asked for an example of a success story. So if you're able to share just kind of a general example, I think that would be helpful for the audience to hear.
Okay. All right. I mean, the patients are not here, but I guess we can talk about a success story. A few years ago, we had a patient that came in who had medical issues and couldn't breathe. He actually worked in a Spanish radio station, remember him well. And the obesity was affecting his life. He couldn't breathe, couldn't walk well, but he had the sleeve gastrectomy performed. And a few months afterwards, he was back to work. He now actively exercises. He's down to his goal weight, and it's completely changed his life. And he has been able to maintain his weight all these years, and I still see him. And then, when that happens, he brings his family members, and that's how, they become family more or less. That's just a brief success story. And we have many of them. We have support groups that you can come and ask patients that in the process, either before the surgery or after the surgery, or patients that are going through the process. And it's better to hear from the patient themselves, and I think that's the best way to hear them.
Absolutely. And to see how they're doing. And yeah, just to hear the success is really inspiring. So thank you for sharing that. And thank you for the question from the audience. Okay. Another question we have here, are there medical conditions or issues that would disqualify a patient from surgery?
They are exceptionally rare. I think people believe at times they may be too sick or too old to have surgery, but in fact, the more medical problems one has, often the more benefit you will achieve. So we've operated on people who are in the heart transplant list and have an artificial heart. We operate on people who have dialysis. We operate on people with early cirrhosis even. We've operated on people with all sorts of severe medical problems because weight loss helps the function of every single organ system we have. It helps better brain function, better lung function, better heart function. Almost no matter what disease you have, it will get better, or you'll be able to deal with it better, or physicians will be able to manage it better with a normal weight. And on top of that, we extend life expectancy and improve quality of life. It's just such a cool operation because you do 1 hour operation with an overnight stay and people's lives are completely altered. There's nothing else like it in medicine. And when you ask about success stories, Dr. Facalujo is right. Every day, we in our office see a success story, not just once, but 10, 20, 30 times. And that is why we do this, because we're providing health and we're not just trying to put a dike on illness.
Absolutely. And I think as a follow-up, an audience member asked, why did each of you choose bariatric surgery? So I think that's a nice follow-up question to what you just said.
Okay, I can go first. So I got interested in bariatric surgery because of someone I worked with that did bariatric surgery. And I saw the effects on the patients. It does change lives. And I mean, that's why I continue. I've been doing this for about 15 years. That's why I continue to do this. People change. And, Dr. Dalal mentioned it extends life. Comorbid factors get better. So you see people that should have been gone, but they're here because the surgery has been successful, and there's a whole community out there of patients that have had bariatric surgery and are doing well. And I think this is the joy of when we see this is what keeps us going. And that's why I chose it. You can do the surgery minimally invasive and get someone's life better.
Absolutely. And Dr. Dalal, anything to add?
No, I mean, you hit it on the head, right? It's, we go into medicine to help people. And that makes us feel good. And, sometimes in surgery and other fields in surgery, you do the operation and then that's it. But this is a way, really, every patient we see, the benefit that we provide with our knowledge, expertise, and the trust the patient's given to us, and change lives forever. It's just fascinating. It's amazing.
Absolutely. I've learned so much just from this webinar, so I can only imagine. But all right, well, we have one last live question from the audience here, and then I will go ahead and ask my final question for tonight as we start to wrap things up. But this last question here, this person is wondering, how long does it take from an initial consult to actually having the surgery done?
All right. That depends, I must say. So it depends on you, how quick you can go through all the consults, seeing all the physicians, and also depends largely on the insurance companies and their requirements. For example, if the insurance company requires you to see the nutritionist for 6 months, then usually we can't shorten that. But as soon as all the things are done, what we do is we submit to the insurance and we get an approval. Within 2 weeks, we can get you in, more or less. So with us, we can usually get you in, and because we do the surgeries regularly on a weekly basis. But the duration itself, for example, someone that has the Horizon Insurance system in the office, it might take about 3 months, 90 days, to get everything complete from start to finish. Or someone with Blue Cross Blue Shield, either from Alabama or somewhere else, that usually 6 months for nutrition at least. So it depends on a lot of factors. But I mean, it's been shortened now. Before it was a year, but now it's usually anything from 3-4 months. That's the average, and then at most 6 months. Rarely do you get up to a year anymore.
Okay. Well, sounds like it depends a little bit. So thank you for that. And I see we're getting a few more questions in the chat. So let me go ahead and have you answer these before we turn to my last question. Another question that we just got, will this surgery help with balancing female hormones or menopause?
Great question. So these operations in general really improve fertility and improve people who suffer from polycystic ovarian syndrome, PCOS, or irregular periods. And it regulates estrogen production much better. So the short answer is yes. The vast majority of people have improvement in their hormones. And this is true for both men and female and women as well. There's improved sexual function in men, improved fertility in women. We've had women who have sought me out because they were unable to get pregnant despite all the infertility treatments. We've had surgery, and then all of a sudden they get pregnant. We've had some accidental pregnancies too, so be careful. So in general, yes, but there's the occasional person who may have like some persistent irregular periods, or things like that afterwards.
Okay. Overall, sounds like some great news. So thank you. All right, another insurance related question coming in. Does Medicare or Medicaid cover the surgery?
Yes.
Yeah.
Both. Yeah. Yeah.
Awesome. Well, that's great news to hear. Okay. All right. So with that, thank you to the audience for submitting such great questions. We have learned so much throughout tonight. So it's incredible. I want to go ahead and ask a final question from myself. So what do you want attendees to take away from tonight? And are there any questions that you would suggest patients ask their provider? Dr. Fakaluja, we'll start with you first.
Sure. Thank you, Sarah. So I mean, the takeaway from tonight will be, bariatric surgery is safe. You find a lot of myths out there that people come and say, oh, I've heard of this person that died from this. Bariatric surgery is completely safe. It actually helps medical issues. You reduce the weight, your medical problems do get better. And, we're trying to just crush that myth that it's dangerous. No, this is surgery we do every week now. We're more or less proficient in it, so it's safe. And, when you come to a provider, you should ask about the different options. Even if they don't offer it, they're going to tell you, ask about the different options and what you expect from the surgery. What do you want to gain from this? I mean, yes, the side effects is you look nice, but how about your comorbid problems? What do you want to gain out of this? And you have to work with the surgery more or less. There will be some restrictions. It's not like you're not going to be on a diet for life, but your taste for certain foods are going to change, and we have to be prepared to change that. So that's really it. Thank you.
Thank you so much. Okay, and Dr. Dalal, I'm sorry. Any final remarks for tonight?
The decision to have weight loss surgery is probably one of the more difficult ones people make. Most people spend not a weekend or a week or a month, but they spend years deciding on this worrying about this, being frustrated about their weight, trying multiple other routes, researching on the internet, talking to friends. Um, and I would say that many patients after surgery say they finally feel freed from all that struggle. They don't feel imprisoned in their body anymore. They don't have to wake up every morning thinking about, am I going to be able to stay on this crazy diet? um, they can focus on their kids and their grandkids and traveling and feeling normal and breathing and not worrying about booths and not worrying about seatbelts and not feeling embarrassed going to the doctor's office and not being frightened of scales. This is so life changing in ways that most don't even understand because it may have been since they were in elementary school before they had felt they were a normal weight before. So, what I would say is yes, this is a big deal. It's a big life change, and do your research. Talk to people and talk to your surgeon because we're not here to convince you to have surgery. We're here to provide you information and help you make decisions.
Absolutely, definitely life changing. And a follow up question there. I know we mentioned, do you have any questions that you would suggest a patient ask their surgeon? Any important questions that come to mind for patients to think about when they're, approaching the topic and thinking about it?
Surgeons. Um, with regards to, I mean, again, experience matters, how long they've been doing this, and then also the success rates. I mean, now I guess the data is out there, you can look at the data of the surgeon and see, the success rates and everything. So I think it's a good question to ask, and then I'll let Dr. Dallas speak. Thanks.
Um, I think I had said before, shop around and find somebody you connect with and that you trust and who's experienced. Now, luckily, everybody in the Jefferson enterprise, we're all here because we have been vetted as experienced surgeons already that have done extensive additional training in this subspecialty. But find the person that you connect with. And that's really helpful. It's helpful for me and it's helpful for the patient.
Absolutely. Thank you. Do your research, but also find those relationships. So thank you both. We so appreciate your time this evening, Dr. Fakaluja and Dr. Dalal. Such great information was shared. I know our audience learned a ton. And thank you all for submitting such great questions. What a terrific discussion tonight. So thank you for joining us. We will be posting an event survey, so you can let us know your thoughts. Your feedback will bring more virtual events like this to you, the patients. And if you would like someone to contact you directly to schedule an appointment with a Jefferson Health provider, please fill out the last question in the event survey. A recording of this event will also be sent to you so you can rewatch. And if you would like to view other wellness webinar series events, please visit our Jefferson Health YouTube channel at youtube.com/Jefferson Hospital. We have everything from men's and women's health to robotic surgery to planning for pregnancy, age-friendly care, and much more. If there is anything anyone here at Jefferson can do for you, please reach out to us. Thank you once again for joining, and please be sure to stay safe and healthy. Have a wonderful evening. Good night.